Hi, I'm Ruthi Landau. I'm with the Anesthesia Patient Safety Foundation, and we're here today to give you an overview on what to expect if you're having a C-section. The different types of C-sections, the one where it is booked, it is planned, and you're expecting it. And there's the type where you didn't plan it, you didn't expect it, but it's happening sometimes fast and sometimes not that fast. So there are different options for anesthesia for cesarean section. I will start with the one that we know is the most commonly performed in the United States and probably around the world as well. It is a spinal anesthetic. It is the easiest, fastest, most reliable, and probably the one with the lowest risks and complications and most comfort for women. The second one is a combined spinal epidural, which is a variation of a spinal anesthetic. We actually do a spinal, but we also place an epidural catheter. That is if there is any desire to maintain anesthesia for longer or pain relief after the cesarean section, the catheter can stay in place. An epidural catheter is a very small plastic tube that is placed in the back, in the epidural space. And it is very important to know, it is very small. It is much smaller than what goes in the back of the hand as the IV catheter. And the advantage of having the plastic tube in the back being that small is that we can actually tape it very well to secure, to make sure it stays in place, even though women might lie on their back, or women might turn around, or they might sit in bed, or they might be transferred and transported onto the operating room table if they need a cesarean delivery. And in that case, because it's well secured, it stays in place and women don't feel it. They can lie on it without feeling it. It's like lying on your hair on your back without feeling it. The third one is an epidural from the get-go in women who might have had an epidural during labor, who then need to have a cesarean section. The anesthesia team will use the epidural catheter to give stronger medication, and that allows not to have to repeat a procedure in the operating room if that epidural was placed earlier in labor. The fourth one is if at any time point it is decided and desirable to have a general anesthetic. I just want to mention that it is not common. Probably around 5 to 10% of women have a cesarean section under general anesthesia. Sometimes it is decided from the get-go that this is the best and safest approach. Sometimes it's not the first approach. There might be a spinal or an epidural or a combined spinal epidural that gets converted to a general anesthetic, where there is a general anesthetic in addition to the initial anesthetic. I want to reassure women that there's nothing particularly dangerous about having one and then the second one. We usually try to avoid a general anesthetic just because we think that the experience might be superior for women. They're able to be awake, they can, experience the birth of the baby, the partner can be there, and we always try to make this an experiential event, not take away the birth of the baby or the babies, if it's twins or triplets. And so we try to avoid having to do a general anesthetic, and I don't want women to think that something particularly bad happened if we did convert to general anesthesia. It could be for a variety of reasons, and we will always explain to you before, if possible, and certainly after, why the decision was made to convert to general anesthesia, or why the decision is made to have a general anesthetic from the get-go. So we're going to talk about what to expect if you have a scheduled cesarean section, and then we will go over what to expect if your cesarean section is not planned. For women who know that it is going to be a scheduled C-section, there's going to be time to discuss your medical information. The anesthesia team is going to come and meet with you, usually preoperatively in what we call the holding area. This is the perfect time to discuss with the team that will care for you about any medical issues or any issues and questions you may have. In particular, if you've had a previous cesarean section, if there were any things that you wanted to inform the team about or things that you think could be improved upon, this is the perfect time to discuss these things. Usually the anesthesia team will go over your medical history, any issues you've had, will inform you what the plan is for this C-section, and typically there are different options for the anesthesia, but it is usually a spinal anesthetic or a combined spinal anesthetic, which is very similar to a spinal, except that there is also the possibility to put an epidural catheter in place, and these are things that will be discussed with the anesthesia team. There might be advantages to have an epidural catheter if the case is expected to be longer or if you've had issues previously, but this is really going to be tailored on a case-by-case situation based on what this C-section is for and if you've had previous cesarean sections. For the scheduled cases who come from the preoperative area into the operating room, usually you will be walking into the operating room. We will help you if you need help. You will usually already have your IV hanging because we want to hydrate you since you will have been fasting for a little bit. So we will help you come into the operating room. We will help you sit on the operating room table. From that moment, you will see the team in the operating room. There'll be a scrub tech who will be there with all the instruments that the obstetricians will need to perform the cesarean section. You will see the obstetricians and you will see the anesthesia team. As soon as you will be sitting, we will be placing monitors. We're monitoring your blood pressure, your heart rate. You might have your baby's monitor on. It really depends on the circumstances. And from that moment on, we will start giving you medication. We like to prevent uncomfortable sensations. So for that reason, we give you medication to prevent nausea and vomiting, because there are different things that might be causing nausea and vomiting from, for example, just being pregnant. Some women are nauseous. We give antibiotics, which is there to prevent infections, but some antibiotics that we give you, we know have that unfortunate side effect of causing nausea. So we start the antibiotics, we give the anti-nausea medication, we will try to keep you warm, we usually place a blanket over you, and from that moment on, things will go pretty fast, even if it is a scheduled C-section. The anesthesia team will be getting ready for the spinal anesthetic, so the positioning will be explained to you. We usually want you to be slouched. We usually use the terminology of imagine you're texting on your phone, because we know that that brings women in the perfect position for us of being slouched and looking down. The back will be cleaned with cold soap. We will put a big tray to do things in a clean fashion. We will give you numbing medicine. So important to know, we don't just stick you in the back and do a spinal or combined spinal or an epidural without giving you numbing. However, be prepared. The numbing is a little poke and it does cause a little bit of an unpleasant sensation, but it's a good trade-off so that you don't feel the rest of the anesthetic. And so we always say 10 seconds of discomfort, but all this for your comfort. We will usually wait for the numbing to kick in. It does take a minute. So we give you the numbing. We give you some time to breathe. We might give you some medication if needed. If you're uncomfortable, that's the moment to tell the anesthesia team. And then we proceed with the spinal or the combined spinal after the place was numb, and we will let you know what we do. Sometimes, and it is important to know that you might feel some funny sensations. We call it a zing, or we call it a little electrical sensation. We always warn you that that might happen. Just for you to know, it happens in approximately 10 to 15% of cases. And if it happens, don't worry. It might seem funny, it might seem intense, but in itself, it's not dangerous. We're very close to nerve endings, which is why spinals and epidurals work so well. So sometimes there's this funny sensations. It usually goes away immediately. Then once the medication goes in, we will help you lie down. It goes pretty fast that you will start to feel tingling sensations in your feet. Maybe the bottom of your body starts to feel warm and funny or warm and fuzzy. It starts to kick in fast, but it usually does take, we say, up to 5 minutes to fully kick in. So don't be surprised if you're still feeling things. expect those 5 minutes to be sensations where you're starting to feel number and number. But during those 5 minutes, a lot of things are going to happen. The first thing that the team will be doing in the operating room, the nurses will be placing a catheter. We call it a Foley catheter. That's the one that's going to empty your bladder. You might feel some sensations around there, but I want to reassure you, many women get a Foley catheter without even having any numbing. So it's not in itself something you should worry about. It's just going to be funny sensations. And then the anesthesia team will start checking that you're getting numb. You might not be fully numb yet, but we're expecting some numbness. Teams will check with either cold sensations or just a pinprick or sort of slight scratch to see that you're getting numb, to see that your legs are getting heavier. Expect to be able to wiggle your toes. I say that because many women ask if it's normal that they can still wiggle their toes. Yes, a lot of women can wiggle their toes. I can tell you, I had a C-section myself. I could wiggle my toes the whole time. I checked. I was able to, but I didn't feel any pain. I didn't feel any discomfort. So don't be worried just because you're wiggling your toes that the anesthetic isn't working. The obstetrician will start cleaning your belly and placing a big plastic drape that will be separating you, the anesthesia team, your support person, whoever is going to be there with you, from what's going to happen on the other side of the drape. The reason for the drape is to keep things sterile, clean on the other side, and also because you might not want to see things, or you might be worried that your partner might be seeing things. They won't be able to see things we don't want them to see, or things that might be scary to you or to them. The obstetrical team will be checking one more time that you are numb enough in order to proceed with the beginning of the surgery. And I want to tell you that there are 3 things that we know you're going to continue to feel. So the 3 things we know you will continue to feel are touch, pressure, and movement, which normally should not be uncomfortable. These are sensations that should be fully tolerable. Having said that, if any sensation is not comfortable to you, we want you to tell us. And the one sensation that can be funny or described in different terms by women is the pressure. It could be pressure, it can be pulling, it can be tugging. For many women, it is absolutely fine, and for some women, it is not fine. If for you this sensation is uncomfortable, please tell the team. There are many medications that we can give you through the IV or through the epidural, if you have an epidural catheter, that can help significantly with this uncomfortable sensation. During the C-section, we know that there are different time points where you will feel sensations that we cannot abolish. There's no anesthetic that would make you not feel them. But they're good sensations. In particular, the one where baby is coming out. You will feel it. But the team will tell you when it's about to happen for a variety of reasons. Obviously, the first one, so that you know that this is what's happening. 2, because we want your partner to grab the phone and get ready to take pictures. That is very important. So important to know that pictures are always allowed. Most institutions will not allow videos and will not allow phone calls or any FaceTime or WhatsApp for a variety of reasons. But pictures are absolutely encouraged. We want you to have the best angle. This is why we will let you know baby's about to come out. You will feel it because the obstetrical team is applying a lot of pressure to help the baby come out. What we recommend is to take deep breaths. Usually it doesn't last for more than 30, 45 seconds, maybe a minute. You can do it. It's uncomfortable, but you know that it's for a good reason. Once baby comes out, typically, if everything is okay and lends itself, you will be able to see your baby, and the baby will then be handed over to the pediatric team. Depends on the circumstances, but the partner will be allowed to join the baby shortly after. Things that happen are taking pictures when the baby is weighed, or sometimes trimming the umbilical cord, and these are all obviously great moments. I haven't mentioned it yet, but things that will happen all the time is that your blood pressure will be monitored, your heart rate is monitored. There's always medication that is given to maintain your blood pressure to the values that are important for you to have for your comfort. By the time the C-section is over, at the end of the procedure, usually the partner is taken out of the operating room, back to the recovery room, and the last elements of the procedure, making sure that the uterus is well contracted. We give medication. The obstetricians will check that. You will then have a nice dressing that is placed, and we will bring you back to the recovery room. And this is where usually you will meet your partner, and baby should be there depending on the circumstances. And your vital signs will be monitored. So again, the blood pressure, the heart rate, your temperature to ensure that you're warm. And usually you will be allowed to have something to drink, initially something that's not too heavy. We don't want you feeling nauseous, but quite rapidly you will be able to drink something, eat something, and usually the recovery in the recovery room should be around 2 hours after your C-section. And then usually you will be able to go to the postpartum floor. So the recovery from the anesthesia is going to be gradual. Just like it kicked in from the toes up, it will go down from the upper part of your body down to your feet. It will take a couple of hours, although it can be faster depending on how much medication you got in your spinal. So typically what is expected is for you to be still pretty numb by the time you arrive into the recovery room. You might be able to wiggle your toes. You will progressively be able to move your legs, and the sensations of feeling numb will go away. As you are gaining the sensations and your ability to move your legs, it is possible that you'll start feeling some cramping and some discomfort on your abdomen. If this is the case, it is important that you ask for some pain medication. There is always medication that is ordered for you so that you continue to feel comfortable throughout the recovery in the recovery room. And also, by the way, once you get back to the room, the same medication is available to you. We recommend, and it is standard, to receive 2 classes of medication that are non-opioids. Typically, Tylenol and Motrin is what is ordered, and we recommend that you take it even if you're not in pain. And if, despite having taken these every 6 to 8 hours, you are uncomfortable, then additional medication, usually opioids, are prescribed that you should take if you're not comfortable. The whole purpose is for you to have a comfortable recovery during the 2 to 3 days that you're staying in the hospital after your C-section. So for some women, the plan changes. You come to the labor room, you get an epidural, you're expecting, hoping to deliver vaginally or having a natural birth. And for whatever reason, it could be that labor is not progressing. It could be that baby is not tolerating contractions. It could be that you have pushed like a champion, but baby has not come out. And the obstetrical team decides and explains to you that a cesarean section is now the way to go. The anesthesia team is going to be there to accompany you all along. It starts with using the epidural catheter that you have chosen to have for your labor and delivery. We're going to check a few things. First of all, we'll check that it is still in place. And before we start giving more medication, we will ask you whether it has been working well enough for labor. If the answer is yes, we're going to start giving you medication that is stronger. All those things that we didn't want. We wanted you to feel some contractions. We wanted you to be able to move in bed. Now the plan is changing. You're going to get medication that works great for the C-section. Expect to feel numb up to your chest. It's going to take probably 10, 15, sometimes 20 minutes to kick in fully. If the C-section is more urgent and there's no time to wait for 15, 20 minutes, we actually have medication that kicks in faster. that we can give. We usually can give something that kicks in within 5 minutes. So we will obviously communicate with the obstetricians to know how fast things need to go. You will be brought to the operating room in your beds. You will be moved onto the operating room table. Monitoring will be placed, so the blood pressure cuff, your IV will be running. We will give you more medication. The anesthesia team will check that you are numb enough in different ways, in different time points. Usually the baby monitor will be connected again to check how your baby is doing, whilst the obstetricians are getting ready to clean your belly, to put the drape. And then again, the anesthesia team will check that you're numb enough. They can always add medication through the epidural or through the IV catheter. So there are several options. It will be extremely important to say how comfortable you are, and the same sensations that are maintained with a spinal anesthetic are also maintained with an epidural. In other words, feeling pressure, feeling movement, feeling touch are sensations that are maintained. And pressure can be quite present. Again, don't worry if you feel pressure. If it is uncomfortable for you, there is medication that can be given through the epidural or through the IV that is safe for you, safe for the baby, that works really well to remove these uncomfortable sensations, if these sensations are uncomfortable for you. Now, there's also the possibility that you have an unplanned C-section and you do not have an epidural in place because you haven't wanted one or needed one, or you were not in labor, and things become quite urgent. You will be brought to the operating room, maybe from a labor room, maybe from the holding area, maybe straight from the elevator. Sometimes it happens this way. In that case, you will probably meet the anesthesia team in the operating room. They will briefly ask you questions and they will proceed fast. This is what we call an emergency C-section. Sometimes we call it a stat C-section. We're there for you. We do them a lot. We know it is stressful for you because it's unexpected, but we have different options for your anesthetic. We most likely will try to do a spinal because it's the one that we can do really fast. Or if really there is no time to do a spinal, we want to proceed fast, we will do a general anesthetic. This will proceed pretty fast. We will put a mask of oxygen over your face. We will take you to take a few deep breaths, and we will give you medication through the IV. Even though it's not the usual plan, we want you to know that it is safe. We've done many of these. We continue to do many of these. And during the C-section, even though you are asleep, we will make every effort to have your partner, your support person, be there to meet the baby if possible. We want you to know that we will make every effort to have you wake up without feeling pain, without feeling nausea. You will be brought to the recovery room, and hopefully this is where you will be able to meet with your baby and your family. So the reason we ask patients, all patients by the way, not just women before a C-section, not to have any solid food, usually 6 to 8 hours before a planned surgery, and no clear fluids up to 2 hours before the surgery, is there's several circumstances where patients can get nauseous, and we don't want them feeling nauseous during surgery. And more important, if the surgery is planned under general anesthesia, there is a risk whilst patients go to sleep in that very short period after the anesthesia team gives the medication and before being fully asleep and securing what we call the airway with a breathing tube, that food might come back up and the vomits might actually go into the lungs, and this can cause very serious complication, which we call bronchoaspiration. Now, for a cesarean section, one might wonder, patients are not usually going to sleep. That is definitely not the original plan, but there's always the possibility of having to go with general anesthesia, and for these reasons it's a bit of ifs and buts, but we don't want to find ourselves in a situation where the food or whatever it is that was ingested comes up, back up, and then might go into the lungs, because this is a serious complication of anesthesia. I do want to say, though, that we highly encourage women to hydrate up to 2 hours before a scheduled C-section. So if this is the plan for you, please do drink whatever you like to drink without any milk or heavy things, no milkshakes. The coffee should not contain milk. But we do encourage women to hydrate because it has been shown to be more comfortable and a better recovery. So just because we say do not eat or drink before surgery, keeping in mind what time is the planned C-section, and staying hydrated is actually highly recommended. And I don't want women to be fasting for unnecessary long periods of time. We know how uncomfortable that might be. We know that women in labor have sometimes a reset of their temperature. Some women tell us that they feel quite warm. On the contrary, some feel that they're quite cold. And that's because the brain is working extra hours to create all these contractions. And now that you're going to get numbing medication and that you are moved to the operating room where the temperature is pretty cold, you might feel very cold. So it's not you feeling anxious, it's not your nerves, it's just the temperature control of your body that is not on the right reset. So we can help. We will give you blankets, we will try to keep you warm. And if you are shivering, we understand very well the mechanism behind the shivering, and we have medication that is specifically targeted to remove the shivering. It turns out that this medication is great because it also removes the sensations of the pressure, and it also helps you relax a little bit. So we love this medication that we've been using now for years, but particularly for the shivering, it is a great tool to make you feel more comfortable. That medication is called dexmedetomidine. We're fully aware that sometimes things don't go exactly as you had planned and that you might have questions. So it is important for you to know that we care about your experience, and it has become routine now for anesthesia teams to come and visit you and ask you if you have any questions about your experience. Feel free to voice any questions, any issues, and any follow-up that you might want to have, either with the anesthesia team or other care teams that care about your experience. We are fully aware that these can be very joyful times, but also very emotional times, and it is expected for you to want to have a follow-up, debrief a situation, or get more information that what you might have received at the time of your delivery. I hope you found the information in this video helpful. I tried to address the different scenarios of your possible C-section, but there are many, and obviously I'm sure I haven't answered all the questions you may have. For this reason, please refer to the links in the description at the bottom of the video. There's many information through the Anesthesia Patient Safety Foundation, as well as through the Society for Obstetric Anesthesia and Perinatology. And I hope you will have a wonderful delivery that follows your birth plan, and that the anesthesia team that cared for you provided the best experience and the most comfortable one.